Hey everyone, welcome to Open. I'm Rhina Valentin, your host of Café con Leche for the next hour. Always inviting you to get social with us online, that is. Tweet us and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. And of course, while you're there, don't forget to follow me on Instagram, Insta Stories, FB, Twitter, and LinkedIn at Rhina Valentin. So due to this pandemic, we continue to endure. Many parents are left with the decision on whether or not they will be sending their children to school this year. And although everyone's circumstances may be different, many parents have questions on how to safely prepare their children for the new school year. And joining us to discuss more on this topic, we welcome St. Barnabas Hospital Director of Pediatric Infectious Diseases, Dr. Carine Hedari. Hello and welcome, Doctor.
Hi, good morning, Rhina. Thank you.
Thank you for being here with us.
Thank you for having me.
So, are you in your busy season?
We are in a very busy season. We're happy to see all these kids before school starts. So yes, very happy.
Which brings us to, obviously, this is the time of the year where everyone updates their annual checkup. So let's talk a little bit about what may be different in this annual checkup this year.
Well, I think it shouldn't be all that different. I think it should be done on time. I think it's very important to bring your child to the pediatrician this year more than any year, really, to make sure, their vaccines are up to date, to make sure they're healthy, their asthma is under control, and things like that. So this is how it's going to be different, but otherwise it should really be on time. So don't delay your child's visit to the pediatrician this year.
How important is it for people to get their annual checkup prior to going to school?
It is very important. So it's very important to make sure that your child is healthy, his asthma, so things like asthma and their allergies are under control, and make sure, their heart and lungs are working the way they should be. So it's very important this year, especially that, with the coronavirus going around, it's very important to have your vaccines up to date. So things like the flu is very important this year. It's going to be very confusing with, some of the winter viruses circulating around. So getting your child vaccinated for flu is going to be very important this year.
I see. So flu vaccination is definitely a big recommendation. And because obviously we're still dealing with this pandemic, is COVID-19 a required test prior to going back to school?
No, it's not. It's not. So universal screening is not a recommendation at the moment. So I think just checking in with your child prior to going to school, making sure they're asymptomatic, they're not having fever, cough, runny nose and congestion or any sign of infection. So checking in with your child before sending them to school is going to be the most important step rather than testing your child. Testing should really be reserved for kids that are symptomatic. So kids that develop symptoms of coronavirus or were exposed somehow. So if the school reported a case or they were exposed at home, then testing is definitely important and contact tracing is important.
Right. So I realize that there's still a lot of unknown factors when it comes to this virus. However, there seems to be this myth that it doesn't really impact children and or young people as severely unless they have an underlying condition or a compromised immune system. And so, but I've also read that there's this new disease that is associated or like a mutated version of COVID that is affecting children. Can you share a little bit more on that?
Absolutely, very happy to. So yes, COVID, we know for sure can infect children almost as much as adults. So they're as prone as adults to the disease itself. However, we've been lucky with this virus because in children, it tends to be a little milder. So 20 times less hospitalizations compared to adults, which is very good. And much less death rates, obviously. So like close to 0.5% of children die from the coronavirus, which is very good news for children. However, as you said, a third of the hospitalizations are pretty severe and lead to this multi-system organ injury that can be fatal in some cases. And that's what's been in the news. It's called MIS-C, and it's been in the news. It can cause, severe disease and sometimes can lead to death, unfortunately. But with all that, always keep in mind that the mortality is still quite low compared to the adult population, which is very good news for us pediatricians.
And so that being said, when we talk about COVID-19, there's COVID-19 testing and then there's antibody testing. So,
yes.
Right. So COVID is generally free, whereas the antibodies I don't believe is. I mean, you please help me out here. And what would be the premise in which one should get the antibody test versus the COVID-19 test, right? Because the COVID-19 is if you have symptoms or, you have anything that seems like flu-like symptoms, and then the antibody would be if you think you've had it, right? So just explain that to me and whether that's even necessary as well.
Right. So I think COVID-19 testing is very important, and this is again, so it's gonna be indicated if you were exposed somehow to the virus or you developed symptoms, as you said, and that tests for the virus itself, for the DNA of the virus itself. Now the antibody testing is just seeing if your immune system has encountered the virus at one point, and it's actually much less helpful. It's helpful in some circumstances where we don't know, if a child is hospitalized and we don't know if his symptoms are related to the virus, and we sort of want to prove that he had coronavirus at one point. But otherwise, for the general population, I think this test is overused and vastly, for the majority of cases, useless. So the PCR, which is the COVID testing that you were mentioning, that is available in a lot of centers in New York City, and probably at your pediatrician's office, can be done, is free, and it's very rapid. The results are very quick to come back.
So before we offer, right, I was going to ask you about the turnover with the results. And so with that, you're saying very quick, but how much time more or less? And how close to the beginning of school time should someone get tested? Should they feel the need to be tested prior to starting school?
Right. So again, this test is not perfect. So the test is a rapid PCR. So some of them are very rapid, meaning you get the result in 30 minutes. So some companies have manufactured this test and make it available within 30 minutes. So some centers have these tests, but a lot of centers do a lab that goes to a central lab processing, and that may take 24 hours. And in some centers, there's a backlog, so it can take up to several days. Now that is a test that is only meaningful on the day off. So like today, do I have the virus? Tomorrow is a new day. So, you need another test to prove that you don't have the virus. So again, there is no recommendation for universal testing, meaning that we don't have the means and we're not recommending to test our children every day.
Right.
We're recommending to check in with your child every day before going to school. Make sure that they do not have symptoms. If they do, take them to a center, take the test, and stay at home. Other possibility is if you've been exposed to the virus somehow. So if you have a known exposure either at school or at work or at home, then you should also go for testing.
All right. So lastly, before we go, is there anything anyone can do to prevent anything from happening? I mean, aside from what we've all been conditioned to pay attention to, which is constantly sanitizing our hands and keeping our areas sanitized and wearing our face masks, are there any other recommendations that you can offer?
Yeah, so for kids specifically going to school, I think, emphasizing on hand hygiene, so washing your hands, especially before meals or before drinking anything. Packing your meal for before school, so packing your meal, so not sharing meals with everybody, or not, rather than going to the cafeteria and sharing meals or drinks. getting your vaccines on time, especially the flu vaccine this year, just to make sure that you're healthy, getting your asthma under control, so checking with your pediatrician. Those are very important things. And making sure that you're comfortable with the school strategy in terms of, like, you know, containing the virus, and how, you know, how much they're able to practice social distancing and like implement those measures to curb the virus. So I think those are things that, you know, you need to check before sending your child to school. But otherwise, you know, make sure they wear their masks, especially if they're above 2, and pack hand sanitizers with them. So I think that's going to be the new thing to do this year before school.
Beautiful. Thank you. Thank you for giving us your time, Dr. Hedari, everyone. And you guys, for to make an appointment with a pediatrician, you can go to sbhny.org. And for more safety tips, you can always go to cdc.gov. All right, we have to take a quick break, but when we return, we'll hear how one organization is giving back to the community as we quickly approach a new school year. Don't go anywhere.